But now let's slow on down and head back into the studio with Ron and a special guest.
As you hit it spot on, this is a very important topic. Worldwide, breast cancer is the leading type of cancer in women, accounting for 25% of all cases. How to reduce that risk is the topic of today's Ask a Specialist. With us this morning, Dr. Van Dyken. She's a general surgeon at the Queens Medical Center out in West Oahu. Beautiful campus out there.
It is a beautiful campus.
You know, this is a very important topic today. Breast cancer, what are some of the signs, the early signs that you can share?
So most breast cancer, when it's diagnosed early, is asymptomatic. No breast pain, no lumps, just very asymptomatic. We find them on screening mammograms. Later on in the disease, we do find that you can get palpable lumps, so lumps you can feel. You also you can notice some skin retraction, some tightness, a little bit of nipple discharge sometimes. Those are all signs you should come in. Breast pain, it's usually a sign of benign breast disease, not breast cancer.
Interesting. I was just going to ask you about pain. How do you lower risk, or can you even lower a risk of breast cancer?
There's many things we can do to lower risk. Most importantly, get our screening mammograms. Age of 40, every year, get your mammograms. Other things we can do to lower risk, diet and exercise. We know diet and obesity is associated with many diseases such as diabetes, heart disease, but many people don't know it's associated with cancer, with colon cancer and breast cancer. So maintaining a healthy weight, physical activity is one of the best things that we can do. Other things we can do, we can minimize our alcohol intake. Excess alcohol has been linked with breast cancer. And then minimize hormones, hormone replacement therapy. If we don't need it, try to stay away from it.
What are some of the options should you need surgery? I mean, what are some of the options that a patient has?
So traditionally, options were limited. You could go with a mastectomy, which removes your entire breast, or you could go with a lumpectomy, which removes part of your breast. Traditionally, you know, those options did leave women with a lower self-image and some breast disfigurement. Now we have many other options available to us. Oncoplastic breast surgery, it's a new field, it's very exciting. It's what I specialize in. We can do breast resections, we can resect this breast cancer and then maintain or improve the appearance of the breast. We can do, for example, a woman who has a breast cancer, we can excise it and provide a breast reduction if she has large breasts. If you have a breast that's drooping a little bit, you can excise the cancer, you can provide a breast lift. And remember, federal insurance or federal law mandates that insurance pays for a contralateral procedure, so we have symmetry as well.
Very good. And a reminder, because my classmate's dad had breast cancer, men can have breast cancer too.
Men can have breast cancer, and over 2,000 breast cancers in men are diagnosed every year.
Yeah.
We forget about that.
We don't. All right. If you want more information on this topic, please give Dr. a call, Dr. Van Dyken. You can call us 691-3150 is the number, or go to kh12.com for much more information. Doctor, thank you for joining us on Wake Up today. We can never talk about this enough. I mean, seriously, we need to stay on top of this breast cancer awareness.